I'm co-founder of Angiomedix. And at Angiomedix, we're on a mission to help patients live healthier lives when they have ischemic heart disease. There are 250 million patients who have ischemic heart disease. This is a condition where the heart itself is not getting enough blood. But typically when we think about ischemic heart disease, we think about things such as cholesterol blockages in the coronary blood vessels. However, in about half of symptomatic patients, this is not the cause. They have what is called inoca, or ischemia without these blockages. This matters because these patients, one, they're really prevalent. It predominantly is women who are affected by this, but also it's not benign. It significantly increases your chance of severe cardiac events, including heart attacks. And therefore, it's also a real problem that many of these patients can go years before they get a diagnosis and can get the proper treatment they need. And that's what we're looking to change. So what I'm showing here is in the US, every year, there are about 1 million patients who are getting a procedure that is called a coronary angiography, where you look into the blood vessels and coronary blood vessels to see if there are these blockages. But as I mentioned, only half of patients will get a diagnosis this way. This is where Dr. Smit Shah from Yale University is really leading the way in adding additional testing during this procedure in what is called coronary function testing, which allows you to evaluate the health of these blood vessels and make diagnoses that underlie inoca, including vasospasm, microvascular disease, and other things. Based on a recent clinical trial that Dr. Shah completed, which was a prospective multi-center trial of 500 patients, he was able to create a diagnosis for 95% of these patients. And this really matters because it allows you to give targeted treatments to these patients, which leads to better outcomes. And based on an independent study by the Mayo Clinic, you can also significantly save on healthcare costs, up to $24,000 per patient from lower amounts of hospitalizations and additional diagnostic testing. Coronary function testing is something that's really proven by this point. There is evidence in tens of thousands of patients that it's effective and safe to use. And it also leads to very quick improvements, as you can see by these patient testimonials. So really what we're focusing on right now is how to scale this procedure to as many interventional cardiologists or cath labs as possible so that as many patients as possible can get their diagnosis. For this, we need three things. First, one of the pharmaceuticals you need for this procedure is a pharmaceutical that is currently off-label and requires a lot of effort to prepare for the procedure. And so we're currently working on reformulating this specifically for our use and bringing it on label with the FDA. We're also working on a device that simplifies safe delivery of the pharmaceutical so that it's as accessible as possible to new users. And finally, through grant funding, we're also working on an app that allows patients to better track their symptoms so they can have the right conversations with their clinicians. We believe there's a very fast path to market for Angiomedix, where we can be on the market as early as 2029, where conservatively we estimate it's a market of around 100 million within 3 years, based on already established reimbursement practices. Right now we're raising a seed round of around 4 million, which would allow us to get to an IND because a lot of the work we have to do is in CMC and much less around preclinical efficacy work. We currently have a core team of Dr. Smit Shah and myself with excellent clinical advisors. We also are currently formalizing our business advisors, which I hope to share next time. So with that, I'll stop, but I would welcome to continue the conversation with anyone who's interested. Thank you so much.
All right.